Hello, ladies and gentlemen. Could we please take our seats so that we can get started? It'd be great. Don't want to get too far behind schedule today. There's a few people milling around outside, so I think they're pouring in. Oh, look at them pouring in. Fantastic. There's some seats at the front for anyone who doesn't have a seat. Lots of them. It's funny, nobody wants to sit at the front of the room. It's, every place you go, it's the same. Great. It's gotten quiet. Terrific. So, I'm going to kick off today. If we get most people in the room, I think we're almost there. Yes, okay. Shall I get started? Okay. Hello, everyone, and welcome. My goodness, we have a big crowd today. My name is Dr. Ruth Carter, for those of you who don't know me. Many of you do, but some of you may not. And I'm the director for the Mental Health and Addictions Program at the IWK Health Center. And the IWK, in partnership with the Department of Health and Wellness and the Nova Scotia Health Authority, have all come together to launch this official kickoff for trauma-informed care. And together, we're working very closely with our partners cross-sectorially. We have a lot of different community partners with us here today, and we will across the next several days when we host these sessions. So we are very fortunate to have this many people demonstrating an interest in this work. So what is trauma-informed care? So trauma-informed care basically is a strength-based service delivery approach that's rooted in understanding of and the responsiveness to the impact of trauma. And that work emphasizes the physical, psychological, and emotional safety for the providers, the clients, and the families. So what's really important about this work is that it's not just about how we engage with families, it's about how we engage with staff, how we engage with each other, and how we create a trauma-informed care environment for our staff and for our clients and families. So we at the IWK and across NSHA are very pleased to say that there has been an overwhelming enthusiasm for this work. We have started about 18 months ago, maybe a little bit more, started to do some work on this transition to a more trauma-informed care environment. And we have found that everyone we've talked to has been very, very engaged and very enthusiastic about this transition. And that most people are wanting to jump on board, help out, join working groups, and be very engaged in the work. And this goes across all of our healthcare environments, across the IWK, also in women's health programs and in surgical care programs, etc., across the IWK. Also, we found across all of NSHA, of course, and mental health and addictions programs. Emergency departments are very interested in this work, and our partner organizations, our community services organizations, and are also very interested in education. Actually, I've been doing some work on their own, obviously, before we started ours, but have joined forces with us to some degree, and as has justice and education and community services. So we have had a lot of interest generated, and then there's also the other private and publicly funded services such as the Youth Advocate Program and ACOMA and ISANS, just to name a few, that have joined on and wanted to be part of this work with us as we develop our committees and our working groups. So there's lots of enthusiasm and people are very excited about it. So over the next 3 days, we are welcoming over 700 staff across the province to one of our 4 in-person sessions. So that's a lot of people. There's a lot of people here today, and we have 4 of these sessions scheduled. They're all filled to capacity. And we have another 400 people joining online. So that's for our webinars, over 400 actually at this point. So we are getting to and getting engagement from and interest from a large number of people. I want to welcome all of you here today to this official launch. This is really the real kickoff. We've been doing some background work for a while, but this is really our jump-off point for this trauma-informed care. And what we're doing here today is introducing the concepts to create a trauma-informed care environment for those that we serve and those who provide service. So we're here about learning about the concepts to create a trauma-informed care environment. And what we want to do is we want to embed trauma-informed care into organizational culture so that we can reach a standard of practice as an organization or as organizations that incorporate the principles of trauma-informed care. And you'll learn more about those principles today and over the next several days and over the next several months. So this is not just a one-time learning opportunity. This is a launch and a kickoff. The learning and the engagement and the work that needs to be done is an ongoing piece of work, which you will learn more about as the days come. Also today, as part of this official launch, we'll be introducing our new trauma-informed care logo. And I think you see it all around the room on the posters. And we are officially going to be launching a website, I believe, as well. So for trauma-informed care for the province. So those are some of the pieces of work that we're going to be undertaking. So I wanted now to take a few minutes to tell you about our presenter today and our keynote speaker, who is doing the most of the speaking today. And this is Lori Beyer. And Lori is a director of trauma training and education at Community Connections. And this is a private non-for-profit agency providing a full range of human services in metropolitan Washington, D.C. So Community Connections have developed creating cultures of trauma-informed care, a protocol. So it's a protocol about how to help organizations become more trauma-informed, to become certified actually as trauma-informed care organizations. So she has undertaken this work with a number of organizations, and she's going to help us to do this work as well. This work is based on the research of Drs. Maxine Harris and Roger Follett, two leading researchers and authors in the field of trauma-informed care. Ms. Beyer specializes in providing workshops, trainings, and ongoing supervision and consultation to agencies and clinicians nationally on issues related to trauma-specific and trauma-informed service provision. Ms. Beyer has over 24 years of experience working with adults who are dually diagnosed with a serious mental illness and substance abuse disorder and have histories of homelessness and violent victimization. She was an original member of the Community Connections Trauma Work Group, which developed the Trauma Recovery and Empowerment Model, TREM, and has co-led numerous group treatment interventions in areas such as trauma recovery and empowerment from women and men. Parenting skills and domestic violence as well, and has served as a clinical case manager, clinical housing coordinator, and as a supervisor of trauma clinicians in 2 federally funded research projects. So she's quite a breadth of experience to bring to work with us today. In a few minutes, we'll ask Lori to join us. But first, I'd like to take a few minutes to introduce Holly Murphy. Many of you in the room know Holly. Some of you may not. And Holly is she is the clinical project manager of trauma-informed care at the IWK Health Center. She has helped to create a wave of excitement around this work, along with the team that she works with, so I'm not to underestimate the work of the entire team. And this is resonating, as I said, very strongly with people across IWK and Nova Scotia. Holly will soon be joined by another clinical project manager who will work with the team, with the NSHA team to help to roll out trauma-informed care within the province. So I know that when we talk about trauma-informed care, that there's still lots of amazing work that's been done prior to us engaging in this work around trauma and trauma-informed care, trauma treatment and trauma-informed care. Lots of amazing work has been undertaken. We're not trying to minimize any of that. We're just trying to expand and move forward and to make sure that we are providing as much a trauma-informed service as possible. So Holly right now is going to do some introductory remarks, and I'll pass it on to Holly.
Thank you, Ruth, and welcome everyone. It's so great to see so many familiar faces in the room and some new faces to join us on this journey. First off, we just want to mention just some housekeeping items for everyone. So to make sure everyone knows where the washrooms are. So as soon as you come up the stairs there, they were just to your left. So as you walk out of the room, they're just to your right down the hallway. There is a coat check room too, if anybody over the time wants to check their coat. Also, if you're able to, I know we're We all have cell phones in here. If you're able to put them on vibrate, that would be appreciated, just so we don't. We are videotaping this, is another important piece of it. So just to note that, and let us know when we do questions and answers if there's anyone that doesn't want to be on the videotape. And we can definitely make sure that you're not in the video there. So again, if you're able to make sure your cell phones are on vibrate, just so we don't have kind of ringing going on through the room when the videotaping, that would be wonderful. Thank you. So we're just having a little bit of technical difficulty, but since I remember most of this, we're in good shape. So I just want to start to say, yes, as Ruth said, we're feel very privileged today, very, very excited that all of you are joining us on this journey. And there we go. So we're going to be talking about this journey and introducing you to trauma-informed care. Creating physical and emotionally safe environments, and as Ruth said, it's for clients or patients, as we could also refer to them, families and staff. So it is very much a collective journey that we're going on. So here we go. The welcome and agenda. So first off, I'm actually just going to get. Do you want to give me slides? It's hard for me to see the screen there, so it might be just easier for me to have this. Thank you. Great. Thank you. So first we're going to go through an introduction to trauma-informed care to make sure we're all on the same page, knowing what we're talking about when we define trauma, when we talk about trauma-informed care, looking at how do we create trauma-informed environments. So Lori is really going to take us through how to create those environments, how to create trauma-informed organizations, and then looking at, we are going to have a 15-minute break in the middle, so we will be having refreshments and some snacks for everyone during that time. Then we're going to move into the other piece of it, as I mentioned, that is super important, is how do we take care of our staff in a trauma-informed organization. So Lori is going to be speaking to us about that. And then we're going to go through a bit of what have we been doing so far and what we hope to do over the course of the next few months and years as we go towards becoming a more trauma-informed collective culture. And then we're going to take you through our logo and website, so that way you're able to access information, articles, different things we have on our website to help you through your practice as you leave today. So when looking at the purpose of today's session, we're really looking to provide the foundational information about trauma-informed care and associated staff support as we start this journey. It is a culture change, so we're looking at about a 3 to 5 year journey for this in order to become trauma-informed as organizations. Our objectives today are really to look at introducing you to the key concepts and principles of trauma-informed care, again, discussing how to create trauma-informed care environments and organizations, discussing how organization can support staff experiencing stress, burnout, and vicarious trauma, looking to describe ways in which organizations can respond, how organizations respond, professionals can respond, and personal individuals can respond and contribute to a psychologically safe and healthy workplace. We're also going to look at how the IWK look at our process and how we're moving to become more trauma-informed. So before I get into the definitions, I also wanted to mention that some people have asked before the presentation, is there any disturbing images going to be shown? Is there anything that may be triggering for me? And we just want to let you guys know that there is no images that would be, that we don't have any images in the presentation that will be triggering for you. If there is anything in the topics that we discussed today, please take care of yourself. We are going to be talking about how staff may experience stress or burnout or vicarious trauma. So if there's anything, is you kind of reflect on your own personal self as we go through that. If you need a break, need anything at all, need to take some time for yourself, please do so and take care of yourself, because we know that's the first and most important thing to do. And also, within your books that we did give you, there is a card there that just kind of reinforces to some supports that we do have in our communities, and some of us have, such as EAP, so Employee and Family Assistance Program, I should add in there. Also, your occupational health and safety departments within certain organizations if you have them. And then there's also a website for different community health team programs if you're looking for more prevention strategies and how to stay well. So they're also in there too. And if you need any assistance too, please, any of us that have a tag on, we're with the team, so you can always approach us too, and we can also assist you with any help that you need throughout the day. So we're going to start and talk about stress first. So stress, we all experience stress in life, and if we think about child development, there's a lot of different types of stress. So as a child, we can experience positive stress. So this is something that child may experience, so such as going to school for the first time, feeling frustrated, but they have that supportive caregiving system behind them that helps support them. And it's a necessary part of healthy development. So we all need that to kind of grow, understand the way the world works, and kind of go through life saying, okay, I've gotten through that, it's okay, it's somebody to support me, and now I can kind of move on and experience different experiences again within that stable and supportive relationship. And then we get to different type of stress is called tolerable stress. So it might be more severe, so it could be something as an injury that somebody experiences. But this is still buffered again by the supportive caregiver. It's tolerable, it might be a limited time period for someone, and it gives the brain the time to really adapt and recover from potentially damaging effects that may have occurred. And then we get into toxic stress. So what we're talking about here is really an overwhelming event or experience that happens, and it's not buffered by a supportive caregiver. So we're looking at such as abuse and neglect, for example. And this type of stress can lead to lifelong problems, possibly, and learning behavior in both physical and mental health, in our physical and mental health, and can also cause psychological changes that may become permanent. So it's something that we really need to think about when we're talking about stress. So we're also going to get into resiliency, too, in a second, to talk about that, too, because people experience things differently. So what is our definition of trauma? This is important to set the stage so we're all thinking about trauma in the same way. So really when we talk about trauma, we're talking about, it can be anything that may overwhelm somebody's capacity to cope. So it could be an experience or an event. A lot of times in the original literature it talked about events, but it's been really expanded to experiences. So could be any experience that overwhelms somebody's capacity to cope. So this could be resulting from such things as abuse and neglect. It could be from family conflict, poverty, having a life-threatening illness, undergoing repeated and/or painful medical procedures, accidents, witnessing acts of violence, grief or loss, and intergenerational effects, etc. So that's kind of the definition that we're working with. The other thing to mention about trauma is that trauma, as we're going to get into some statistics with it, is common, but people's responses to trauma isn't. So we all respond differently to trauma. Some different types of trauma. So acute trauma would be something like a car accident. So it would be something that happens, it's a one-time single event. And then we get into repetitive trauma. So this could be something that's repeated over time, multiple exposure to the trauma, and over prolonged. So it could be something like receiving a regular treatment for an illness, which may be invasive as a medical procedure. Then we get into complex trauma. When we talk about complex trauma, it really results from chronic, multiple, prolonged instances of traumatic events or experiences, which are compromising and really within the context again of that interpersonal relationship. When we talk about complex trauma. And then when we talk about infants, children, and youth, we're really looking at complex developmental trauma. So again, it's resulting from early onset exposure to ongoing repetitive trauma, so that repetitive trauma, but it is as an infant, child, or youth. And it can also include, as we talked about, trauma such as neglect, abandonment, physical, sexual abuse, emotional abuse, witnessing violence, coercion or betrayal, and this often occurs within, again, the child's caregiving system and the people that they trust, and it does end up and can interfere with healthy attachment and development. When we talk about trauma, the other definition we want to make sure that people are aware of is vicarious trauma. So when we talk about vicarious trauma, it really creates a change in the service provider that's resulting from empathetic engagement with the client and the patient's traumatic background. And this occurs when the individual was not an immediate witness to the event, but over time, hearing the stories of clients that you work with, they can have a definite effect on your own health, and really you end up incorporating those kind of, whether it's images or stories, can have an effect, disturbing effect on your own experiencing and your own functioning. So that's something that we want to keep in mind, and that's why we have a session today really looking at how to support staff in a trauma-informed environment, because we want to make sure that all of us are supporting each other and, doing everything we can for ourselves to be well in order to take care of ourselves, our own families, and then our clients and families. And then another definition that's important to mention is historical and or intergenerational trauma. So when we talk about this, it could be emotional, psychological, and or physical trauma that can affect cultural groups, communities, and or generations. We're talking about trauma that can include racism, colonization, a loss of culture, forcible removal from a family or community, slavery, genocide, war. So these are some examples of that. And really coping and adaptation patterns can end up developing in response to the trauma and actually be passed through the generations over time. So we really want to keep that in mind as we talk about trauma. So effects of trauma. You can see there's lots of effects of trauma. So trauma can, as we say, potentially have these effects across all different aspects of our life. So we can have, so the physical context, it can be looked at, we can have eating and sleeping difficulty, we can have experience pain differently, have low energy, headaches, pain, anxiety. If we look at the emotional end of it, really looking at maybe depressive symptoms, maybe really crying a lot, being anxious, panic attacks, feeling angry or irritable, and difficulties maintaining relationships. So we may experience that. Behavioral, so we may end up experiencing self-destructive behaviors. We may start to isolate from our loved ones. We may end up being, with people or choosing friends that may be not as healthy for us. Using substances, start to cut, and even to the point we may attempt suicide. On the cognitive end, there's lots of cognitive effects, so looking at memory lapses, difficulty concentration, having those memories flood back, looking at not being able to make decisions easily, and also, there we go, and again, it could also be thoughts of suicide also. And then the spirituality piece of it, as individuals, we may start to feel that we're damaged, that we feel like we're bad, that we don't have that connection that we used to have, or feel guilty, and kind of questioning one's own purpose. So as we can see, it affects our whole system. Now the piece that we also want to talk about is resiliency. So we know that people can experience trauma. I may experience a traumatic event, and someone else may experience it. And they may experience, could be even siblings that we see that we work with. And what sibling is able, to get through that, and for whatever reason may have people within, the school system or people that they have, support that's able to support them, while the other person may not get through the event so easily. So we just wanted to go over this quote with you guys because we thought it was even broadened the concept of resiliency from not even to individual resiliency, but how we create resiliency within the community. So in the context of exposure to significant adversity, resilience is both the capacity of the individual to navigate their ways to the psychological, social, cultural, and physical resources that sustain their well-being and their capacity individually and collectively to negotiate these resources to be provided in culturally meaningful ways. And we're actually going to take you to a video that's on resiliency, and this is from the Resiliency Research Center. This is from the Harvard Center on the Developing Child. So we're going to take a look once we get up there.
Why do some people do well despite serious hardships? The science of resilience can help us find answers.
We define resilience as a good outcome in the face of adversity. The extent to which we can build capacities in all children early in their lives to be able to deal with whatever bumps in the road or major obstacles may be coming down the track. That's an investment in building strong human capital and healthy, productive adults.
Some children face more obstacles and adversity than others.
It's like having a parent with a major mental illness, growing up in a very socioeconomically disadvantaged community, going to schools that are not good, being exposed to violence in the neighborhood or in the home.
But some children do well despite these significant obstacles.
Resilience is that ability or set of capacities for positive adaptation, allowing you to keep in balance.
We're talking about the kinds of capacities and skills and the abilities that give people a sense of mastery and management of difficulty.
It's tempting to think about children as either having this resilient quality or not, but resilience is built over time, just as and in parallel with how the architecture of the brain is built over time.
It's not just in the person, it's in the interaction between the person and the environment.
So we care about resilience for the same reason that we care about promoting healthy development, because in many respects it is the same. We are interested in promoting resilience in children so that, despite the odds, more and more children can grow up to be productive citizens.
Thank you. Okay. So how common is trauma? And there's seats up front. I know some people are standing in the back, but please, there are seats up front, and no worries, it's all good. So we know from lots of studies that trauma is very common. We know from the ACEs study, which Lori is going to get into a bit more later in her presentation, that between, oh, sorry here, I'm just going to turn this over. Between 55 to 90% of people experience one or more forms of trauma in their lives. We also know from, and that's an American study, so we know from Canadian studies that about 76% of the Canadian population in this one study they were actually called via census data, and they said about 76% of them were exposed to at least one traumatic event in their life. When we talk about mental health and addictions, there's another study that actually gets into the possibility that 90%, based on this study, of their 505 clients had been exposed to trauma. And I think from having conversations with you in the room that, a lot of the clients that we see do have trauma, so that's something common that we do see in our practice. And as such, we really need to think about this as a universal precautions. So really, if we think back to the time where we said, okay, if somebody has a blood-borne illness, we're going to use gloves, we're going to use personal protective equipment, and then it came to the point, okay, universally, we're just going to use those anyway. It's kind of the same premise in the sense that we really want to say we want to create these safe and secure environments for everyone. We want to make people feel safe. So we're going to create these spaces that are trauma-informed and do that for everyone, knowing that the rates of trauma are very high. So what is trauma-informed care? And we did highlight this a little bit earlier. I think Ruth talked about it. It is really a universal, systematic, strengths-based approach rooted in the understanding and the impact of trauma, and emphasizing the physical, psychological, and emotional safety for both, again, the providers, the clients, and the family. So it is really an approach that we're looking at that we can all do. And it's not just, when we talk about it, it's on so many levels. So when we talk about us working with a client or a family, we want to use a trauma-informed approach. When we work together as staff or as a team, we want to do that. When we work with different departments or community agencies, we want to model that. So we just don't want to say, okay, as we work with our clients, we need to make it safe, we need to be trustworthy, we need to have choice, we need to do all these things. We actually want to model that for people. We want to create a culture within our province that really embodies those characteristics and principles, and that we really live them. And we really work together to meet the needs of our clients and families together. So this is a visual of kind of trauma-informed care, and just gets to the principles. So, and again, being trauma-informed is really about creating safety and trustworthiness within our healthcare practices, within our social interactions, and our physical and emotional environments for clients, families, and staff. So as I mentioned, the principles of trauma-informed care, they're awareness, so really having the awareness of trauma. Safety, so how do we create that safety both in a physical sense within our physical environments, and then emotionally in our emotional environments or therapeutic interactions. How do we create trustworthiness? So how do we, again, create those relationships that people feel, that they're safe, that they have trust, that they can really work with us in a partnership. That they have choice, so making sure that we're offering as many opportunities for choice as possible. Having collaboration, so it is really that partnership that we're really trying to move towards and build upon. And skill building, so we really want to focus on that is, people come with many, great skills, and, how do we build on those skills and what they want to work on. So why would we become a trauma-informed environment? So there's a lot of reasons to do that, both, again, on the patient experience side and on our staff side. So we want to become trauma-informed because it is more of a proactive approach than a reactive approach. It is strength-based. We wanted to create and sustain the ingredients for those that work in a patient and family-centered care environment. It's definitely very complementary to that, really looking at how do we maximize our choice and control and partnership. We want to reduce any possibility of re-traumatization. So that's the other piece that I think we need to think about. Some people come into our organizations that have experienced trauma, but also sometimes they may unfortunately experience through our services. So for example, they may be having repeated medical procedures that may be traumatic to them. So we need to kind of be conscious of that too, that some people may actually experience, and again, a loss of a child in a hospital or something. So we really need to think they are traumatic events that happen within our organizations that they haven't brought with them. So we have to be very conscious of that. We want to reduce any of those negative encounters. And again, another example would be of seclusion and restraint. So we're definitely on a prevention we don't want to be using seclusion and restraint. It's definitely something that is a last resort and something that we want to prevent at all costs. We were looking at client and family satisfaction. So organizations that have become trauma-informed have definitely found through talking with their clients and families, through patient and client satisfaction surveys, that as they move towards this approach, they had an increase in satisfaction and increased in, feeling safe, and that they felt their care, was provided in a better manner and had better outcomes. It also will reduce unnecessary costs and reduce the need for unnecessary interventions. So that is another big thing as we look in our healthcare environments and other environments within the communities. That is a big piece of it too, that we're trying to make sure that we're being as efficient and effective as possible. And then looking at our workforce, we know that through trauma-informed care and organizations that have become trauma-informed, it really creates more engagement and support for the workforce, supporting self-care. And it's not only self-care. I know we talk about self-care, yes, we all have to take care of ourselves, but how does the organization enable that? So how does the organization support you to take better care of yourself, and what do they offer with that? It also has been known to increase job performance and job satisfaction within your job, so that is a really important piece. Reduces sick time, and also reduces the negative encounters and events that may lead to burnout or vicarious trauma. So there are a lot of important things that we definitely want to make sure, and that's why we're becoming trauma-informed. Some more benefits and evidence-based benefits. It also reduces trauma symptoms, drug use severity, and mental health symptoms for clients when we're in a trauma-informed approach. It increases effectiveness of service and engagement retention and outcomes. It also is very much, as I mentioned, cost-effective for the treatment, and Lori can talk about that too because it's in her reference there. Decreased patient use of acute care and crisis services. So patients and clients tend not to need kind of the acute care and crisis services if they are in that trauma-informed environment. They do feel safe to really voice what their needs are and be able to get their needs met. And also increased organizational outcomes such as enhanced staff skill building, increased morale, increased, as I mentioned, cooperation, not only within the agency itself, but also with different systems and different partners that they work with. Again, reduced vicarious trauma and fewer negative events. So I think, as I've been talking with you over the past few months, definitely that is something collectively that we all, wish would happen for everyone, for our staff, for our patients, for our families. So that's why we're all here today and hoping that we can really officially start this journey. Within the IWK Health Center and also across the Nova Scotia Health Authority and in different community and systems groups, we know that a lot of people do go by the patient and family-centered care approach, which is definitely one that is our approach at the IWK Health Center. So we wanted just to make sure that it was emphasized, really, this is very complementary. When we were talking with patients and families, and in particular our Family Leadership Council, and we were initially talking about trauma-informed care, they really recognized too that, this is very much complementary. It is about how do we partner together. It is that this is, their care, and they, are the experts, and we're working with them to meet their needs, for them. So how do we share that partnership and that shared decision making with the patient and family. So that much is very much complementary with the two approaches. Providing patient and family with a maximum with choices, control, making sure that that is clear, making sure we're meeting the family needs, respecting again the family strengths and the patient's strengths that they have, and trying to be culturally competent or sensitive and relevant with the population. So just making sure that we're all working together. So I think, and then the trauma-informed care piece, of course, that it brings is really looking at, again, promoting the effective emotional support for patients and families, really looking at minimizing any traumatic kind of symptoms or events for them. So I think really when we look at this, it really does work really well together. I think complements both approaches and is really something that we can build on as we go through this culture change. So some examples of trauma-informed care applicability across WWK and Nova Scotia Health Authority, I think even really the community too, depending where you work, I think some of these will resonate with you. So as I said, many medical interventions can be traumatizing or re-traumatizing, so really keeping that in mind, that we really need to look at that across their services and meeting the needs so we're not causing that if at all possible. Recognizing the importance of partnering with patients and families in shared decision-making, recognizing the impact, for instance, sexual abuse or domestic violence can have with women experiencing prenatal care or when they're having a baby at the IWK. So that's another thing we need to think about. Creating safe and secure environments that support disclosure of trauma. So we want to make sure that if people are ready and want to talk about trauma, that they don't feel that they can't within our environments, and they feel that they'll be supported if they do disclose. Looking at recognizing the impact of seclusion and restraint. So again, making sure that we're really working at our de-escalation techniques and really preventing that at all costs. Looking at first contact. So within our organizations, generally the first people that patients and families see could be somebody working in reception, or it could be protection services, or it could be an administrative assistant, or a somebody doing welcoming with the volunteer services. So we really want to make sure that everyone is aware of what trauma-informed care is, and really kind of embodies that, because it does make a difference if you walk into a facility and somebody's very welcoming and is like, you have no idea where to go and you're lost and can't follow, the signage possibly, that somebody's really there to say, welcome, and that, we can help you get where you need to go. What do you need? How can I help you? Because when people generally enter our facilities, they are at a time of stress and do need that assistance. So it is important for everyone to be on the same page. And even for our facilities, departments within our organizations, really looking at how we design spaces. So really looking at if we do have, new construction that is coming up or new projects, that we're really looking at it from the lens of trauma-informed care, saying, how do we make that space as trauma-informed as possible? How do we, design different areas? What touches do we put on it that will make it feel more safer, more welcoming for our clients, patients, and staff? So that's some ways that we can look at that.